Welcome to today's video about side effects of diabetes medicines. Right now, millions of people are taking their diabetes medications believing they're doing everything right for their health. But what they don't know could be slowly damaging their bodies in ways they never imagined. These aren't the side effects your doctor mentioned when you first started treatment. These are the hidden dangers lurking beneath the surface. Before we dive into these shocking revelations about your diabetes medications, if you're new to our channel, welcome to the community. Hit that subscribe button and ring the notification bell so you never miss life-saving health information like this. Don't forget to give this video a thumbs up if you find it valuable. And let us know in the comments which country you're watching from. We love connecting with our global family of health-conscious viewers. Today, we're exposing 10 silent side effects of diabetes medications that could be secretly undermining your health while you focus on managing your blood sugar. By the end of this video, you'll understand why seemingly unrelated symptoms might actually be warning signs from your medications, and more importantly, what you can do about it. All right, let's dive straight into the side effects of diabetes medicines, beginning with number 1. Vitamin B12 deficiency from metformin. Let's start with metformin, the world's most prescribed diabetes medication, taken by over 120 million people globally. While doctors praise it as a wonder drug, there's a nutritional thief hiding in plain sight. Long-term metformin use systematically robs your body of vitamin B12, with research showing that up to 30% of long-term metformin users develop B12 deficiency. Here's what's happening inside your body. Metformin interferes with the absorption of vitamin B12 in your small intestine, with the risk increasing with higher doses, longer treatment duration, and in patients with existing risk factors. Studies show that each additional year of metformin use is associated with a 5% increased likelihood of B12 deficiency, and using metformin for 4 years or more results in a 41% increased odds of B12 deficiency. The insidious nature of this deficiency lies in its gradual onset and non-specific symptoms. You might experience fatigue, weakness, or memory problems and attribute them to getting older or diabetes complications. Meanwhile, your nervous system is slowly deteriorating, with B12 deficiency potentially causing or worsening distal symmetrical, autonomic, and cardiac neuropathy. What makes this particularly dangerous is that the symptoms often mirror diabetic neuropathy. Your doctor might increase your diabetes medications or suggest better glucose control, while the real culprit, B12 deficiency, goes undetected. The tragedy is that this is entirely preventable with simple monitoring and supplementation. Next, side effect number 2, lactic acidosis risk with metformin. While we're discussing metformin, there's another silent threat that's far more acute and potentially fatal: lactic acidosis. This rare but serious condition occurs when metformin accumulates in your system, typically due to compromised kidney or liver function, leading to dangerous acid buildup in your blood. The terrifying aspect of metformin-associated lactic acidosis is how it masquerades as common ailments. Early symptoms include weakness, unusual muscle pain, trouble breathing, stomach pain, and feeling cold. These vague symptoms are easily dismissed as flu-like illness, stress, or simply feeling under the weather. By the time the condition is recognized, patients often require emergency intervention. Research shows that while lactic acidosis is rare, it carries a significant mortality risk. The risk increases substantially in patients with kidney disease, liver problems, heart failure, or during illness when you're dehydrated. What's particularly concerning is that many patients and even healthcare providers aren't adequately monitoring for declining kidney function that could predispose to this condition. The silent nature of this risk means that routine kidney function monitoring becomes crucial, Yet many patients on long-term metformin therapy don't receive regular monitoring. This oversight could prove fatal when combined with acute illness or age-related kidney decline. Next, side effect number 3, hypoglycemia, unawareness. Moving to insulin and sulfonylureas, we encounter one of the most dangerous silent side effects in diabetes management: hypoglycemia unawareness. This condition develops insidiously, robbing you of your body's natural alarm system that warns of dangerously low blood sugar levels. Under normal circumstances, when your blood glucose drops, your body releases counter-regulatory hormones like adrenaline, causing symptoms like shakiness, sweating, rapid heartbeat, and anxiety. These uncomfortable but crucial warning signs prompt you to treat the low blood sugar before it becomes life-threatening. However, repeated episodes of hypoglycemia can blunt these protective responses. Research demonstrates that hypoglycemia unawareness affects up to 25% of people with type 1 diabetes, and 10% of those with type 2 diabetes using insulin or sulfonylureas. The condition develops gradually. Each episode of low blood sugar slightly reduces your body's ability to recognize the next one. Eventually, you lose the warning symptoms entirely, making severe hypoglycemia with seizures, coma, or death a real possibility. What makes this particularly insidious is that patients often view the absence of hypoglycemic symptoms as a positive development, thinking they're better at managing their diabetes. In reality, they're walking a tightrope without a safety net. The first sign of hypoglycemia unawareness might be waking up in a hospital emergency room, or worse, not waking up at all. Next, side effect number 4, fluid retention and heart failure. Risk, thiazolidinediones, including pioglitazone, present another silent threat through their effect on fluid retention. These medications improve insulin sensitivity, but carry a hidden cardiovascular risk that often goes unrecognized until it's too late. TZDs cause fluid retention by affecting sodium reabsorption in the kidneys and increasing plasma volume. Research has documented that TZDs can increase heart failure risk by 40 to 70% in certain populations. The silent progression begins with subtle ankle swelling that many patients attribute to standing too long, eating too much salt, or simply getting older. Weight gain of 2 to 5 pounds might be dismissed as holiday indulgence or lack of exercise. Meanwhile, your heart is struggling with the increased fluid volume, and early heart failure symptoms like fatigue and decreased exercise tolerance are developing. By the time obvious signs of heart failure appear, shortness of breath, significant swelling, or chest discomfort, the condition has often progressed substantially. Research shows that patients with existing cardiovascular risk factors or mild heart dysfunction are particularly vulnerable, yet many aren't adequately screened before starting these medications. Next, side effect number 5, bone fracture risk with SGLT2 inhibitors. SGLT2 inhibitors, the newer class of diabetes medications, carry a silent threat to your skeletal system that most patients never see coming. These drugs, while effective at lowering blood sugar, can quietly compromise your bone health, setting you up for unexpected fractures. Clinical trials and post-marketing surveillance have revealed an increased risk of bone fractures with certain SGLT2 inhibitors, particularly canagliflozin. The CANVAS trial found that canagliflozin was associated with a higher risk of fractures than placebo. The mechanism involves complex interactions with mineral metabolism, including effects on phosphate reabsorption and possibly bone turnover markers. Studies show canagliflozin might increase bone resorption, whereas other SGLT2 inhibitors like dapagliflozin and empagliflozin might not have the same effect on bone turnover. The insidious nature of this side effect lies in its silent progression. Unlike acute side effects that announce themselves immediately, bone density changes occur gradually over months or years, You don't feel your bones becoming more fragile. The first indication might be a fracture from a minor fall that wouldn't have caused injury before starting the medication. Next, side effect number 6, Fournier's gangrene and severe genital infections. Continuing with SGLT2 inhibitors, there's an even more shocking silent side effect that has caught the medical community off guard: the risk of severe genital infections, including the rare but potentially fatal Fournier's gangrene. The FDA identified 12 cases of Fournier's gangrene in patients taking SGLT2 inhibitors between March 2013 and May 2018, leading to an official warning. All 12 patients were hospitalized and required surgery, with some requiring multiple disfiguring surgeries and one patient dying. By 2019, the FDA had identified 55 unique cases of Fournier gangrene in patients receiving SGLT2 inhibitors, with 39 men and 16 women affected. 3 patients died, 8 required fecal diversion surgery, and 2 needed amputations of a lower extremity. These medications work by forcing excess glucose out through urine, creating a glucose-rich environment in the genital area that becomes a breeding ground for bacteria and fungi. While mild yeast infections are well documented, the risk of severe, life-threatening infections was largely unexpected until post-marketing reports began accumulating. The silent progression from minor irritation to life-threatening infection can occur within 24 to 48 hours. What starts as what seems like a simple yeast infection can rapidly evolve into tissue death, requiring emergency surgery, prolonged hospitalization, and carrying significant mortality risk. Next, side effect number 7, pancreatitis risk with GLP-1 receptor agonists. GLP-1 receptor agonists, including popular medications like semaglutide and dulaglutide, carry a hidden risk that can transform from silent discomfort to life-threatening emergency: acute pancreatitis. This risk has emerged from post-marketing surveillance and continues to concern diabetes specialists worldwide. The mechanism isn't fully understood, but these medications affect pancreatic function beyond their intended glucose-lowering effects. Research published in diabetes and gastroenterology journals has documented cases of acute pancreatitis associated with GLP-1 receptor agonists, with some requiring hospitalization and intensive care. The silent progression of this side effect is what makes it particularly dangerous. Pancreatitis often begins with mild, intermittent abdominal pain that patients might attribute to indigestion, dietary indiscretion, or stress. The pain might come and go, leading to delayed medical attention. Some patients describe it as a dull ache in the upper abdomen that gradually worsens over days or weeks. By the time classic pancreatitis symptoms develop, severe abdominal pain radiating to the back, nausea, vomiting, and fever, the condition has often progressed to a point requiring emergency intervention. Acute pancreatitis can lead to serious complications, including pancreatic necrosis, organ failure, and death. Next, side effect number 8, delayed gastric emptying and gastrointestinal complications. Staying with GLP-1 receptor agonists, there's another silent complication that affects quality of life and can lead to serious consequences: delayed gastric emptying, also known as gastroparesis. This side effect develops gradually and is often misattributed to other causes. These medications intentionally slow gastric emptying as part of their mechanism to control blood sugar and promote weight loss. However, in some patients, this effect becomes excessive, leading to significant gastrointestinal dysfunction. Food remains in the stomach much longer than normal, causing bloating, nausea, early satiety, and potentially dangerous complications. The silent progression begins with subtle changes in appetite and digestion. You might notice feeling full after smaller meals, occasional nausea, or bloating after eating. These symptoms are easily attributed to aging, dietary changes, stress, or other gastrointestinal conditions. Meanwhile, your gastric motility is progressively slowing. As the condition progresses, more serious complications can develop. Food remaining in the stomach for extended periods can form bezoars, collections of undigested food that can cause obstruction. In rare cases, this can lead to gastric perforation or require surgical intervention. Next, side effect number 9, vision-threatening optic. Neuropathy, one of the most recently discovered and alarming silent side effects, involves GLP-1 receptor agonists, particularly semaglutide, and their potential association with non-arteritic anterior ischemic optic neuropathy, or NAION, a condition that can cause sudden, permanent vision loss. The European Medicines Agency concluded that NAION is a very rare side effect of semaglutide, affecting up to 1 in 10,000 people, with large epidemiological studies suggesting that semaglutide exposure is associated with an approximately 2-fold increase in the risk of developing NAION. However, recent studies suggest the risks may be lower than initially thought. One study of 159,000 people with type 2 diabetes taking these drugs found 35 people developed NAION, compared with 19 patients in the comparison group. The terrifying aspect of this side effect is its potential for sudden onset without warning. NAION typically presents as sudden, painless vision loss in one eye, often noticed upon waking. However, the condition can also progress more gradually, with subtle changes in visual field or visual acuity that patients might initially dismiss as needing new glasses or normal aging. What makes this particularly insidious is that early visual changes might be so subtle that patients don't report them immediately. By the time significant vision loss is apparent, the damage is often irreversible. Next, side effect number 10, bone loss from mineral metabolism. Disruption. Our final silent side effect involves the subtle but significant impact various diabetes medications can have on bone health through disruption of mineral metabolism. This effect spans multiple drug classes and represents a long-term risk that accumulates silently over years. Both thiazolidinediones and SGLT2 inhibitors can affect bone mineral density through different mechanisms. TZDs influence bone-forming cells called osteoblasts, shifting the balance toward bone breakdown rather than formation. SGLT2 inhibitors affect kidney handling of phosphate and may influence calcium metabolism. Research published in bone and mineral research journals has documented decreased bone mineral density in patients using these medications long-term. The effect is gradual, typically a 1 to 3% annual decrease in bone density that accumulates over years. You don't feel your bones becoming weaker, and routine medical care rarely includes bone density monitoring for diabetes patients unless they have other risk factors. The silent progression means that the first sign of the side effect might be a fracture from minimal trauma, falling from standing height and breaking a hip, or bumping into furniture and fracturing a wrist. These fragility fractures indicate that bone strength has been significantly compromised, often irreversibly. What's particularly concerning is that diabetes patients already face increased fracture risk due to factors like neuropathy affecting balance, vision problems, and the metabolic effects of diabetes itself. When medication-induced bone loss is added to these existing risks, the cumulative effect can be devastating. The medications we've discussed today save lives and prevent devastating diabetes complications. But awareness of these silent side effects is crucial for both patients and healthcare providers. The key isn't to fear these medications, but to use them wisely with appropriate monitoring and awareness. Regular communication with your healthcare provider about any new symptoms, routine monitoring for known risks, and staying informed about emerging research can help you reap the benefits of these medications while minimizing potential harm. Remember, many of these side effects are preventable or treatable when caught early. If this video opened your eyes to these hidden risks and helped you understand the importance of being an informed patient, kindly type "helpful" in the comments. That truly motivates us to continue producing content that could potentially save lives. Please hit that like button if you found this information valuable. Share it with anyone who might benefit from this knowledge. And don't forget to subscribe for more important health insights you won't find elsewhere. Your health is your most valuable asset, and staying informed is your best protection. Thank you for watching, and remember, knowledge is your best medicine.